So you can read his bio in our program, but I just want to touch on a few things. He graduated age 22 from George Washington University School of Medicine, becoming one of America's youngest doctors at the time. He's worked in the private sector, he's worked in the public sector, he's worked in academia, he's been in the White House, he was a top U.S. official at the World Health Organization. He has law degrees from Fordham and Columbia, was first deputy commissioner, then acting commissioner for about a year, and then just earlier this month, I believe, confirmed as commissioner. So my first question is, what took the governor so long to get you confirmed?
I think that it's just the normal process of things. I came in at a time when the legislature was out, and the legislature is out till January. All right, sorry, got it. There we go. Thank you. So the process takes a period of time, and I came in. I was asked to serve as the acting commissioner as the legislature was going out, and then the legislature is out until January.
Sure. And then I'm wondering what your focus will be, or if there's any particular area you want to put emphasis on, or by contrast, is it more about just dealing with issues as they come up? Obviously, like hydrofracking, medical marijuana, those just come up. There are things you had to deal with.
Issues always come up. There's not a day that you walk into the job where there's not an issue that you didn't recognize was going to surface. But there are some things that I really do want to focus on. One of them is the issue of aging. I think that we all recognize how much this is a focus in healthcare today. The population, there's as of in 2009, there were about 13 million Americans who were over 65, and by 2030, there'll be 19 million Americans that are over the age of 65. And I think that we need to look at this from the standpoint of healthcare. And it's not like they're 65 and they only have 5-10 years to live. We have people who are 95, 100 years of age, vibrant, and others who require a lot of assistance. So we're going to tackle that.
Sure. And I mentioned medical marijuana. That was a big thing that went into law while you were acting commissioner. And there have actually been some ongoing discussions about how the process is going. I think you had an 18-month window to get it up and running. And we're on track to get that by 2016?
Absolutely. The governor has asked us to get this moving as fast as we can. Governor Cuomo charged us to move this forward. We will implement this program quicker than any other state in the nation has implemented a medical marijuana program. We are on target to move this forward and to have it operational by the beginning of the next calendar year.
Though I do know some lawmakers are pushing legislation that would allow emergency access much earlier. You had some of these young children with severe epilepsy that came up to Albany and I think played a role in actually getting it passed. And some people say, look, we should make sure that we actually don't wait too long and that we get some of these young patients on a case-by-case basis, also those with life-threatening diseases. Though I guess maybe there are legal questions as well, as having your law background might inform that. So what do you see as a pathway forward on this particular?
Sure, I think that's a great question. I think one has to look at these things from the standpoint of two parts. One is obviously the clinical component to this, to do whatever we can to help people who may benefit from this. And there's also, as you mentioned, a legal component of this. The last thing that we would want to have happen is that this program were slowed down because of some challenge that occurred either legally or in any other fashion. And so what we are doing is we're moving this forward as quickly as possible to implement it, to make sure as many people who could benefit or will benefit will, and that there's nothing that slows it down or stops it for a period of time for some challenge that comes up.
And then also on a federal level, the Times-Union had a op-ed on this morning. There's the issue of the federal ban on medical marijuana. And I'm guessing, what is the administration's view of that, moving forward on a state level where there is at least a theoretical risk that the federal government could shut it down, or that it might be difficult for these companies that are applying for licenses to actually follow through?
We're working with all the agencies in the federal government that would be involved in this, and that's why we're we are tackling this from all the different fronts. That's what I just mentioned before, to make sure that we don't end up in any legal challenge. And we have superb lawyers who have been looking at this. I value their advice and assistance as we push this forward.
Sure. And another big issue that had come up during your year as acting commissioner is heroin and opioid abuse. There was a package of legislation passed last year. I think people were happy that that got done and their steps taken, though I know lawmakers are still looking at that issue and they're concerned about it. And I'm curious, is there anything more that lawmakers need to do, any legislation that needs to be passed? Is there anything more the administration needs to do, or kind of just run with what has been passed last year and see how that goes?
I think one of the big things we all can do is increase the education on this issue. The more people are aware of it, the more people are trained to manage or to treat this overdoses, the better everyone will be. As a matter of fact, we have had thousands of individuals trained to manage and to treat overdoses, and we've saved many lives in the process.
Then I also wanted to ask about hydrofracking. That was probably the biggest, most high-profile issue that you oversaw. You came out with that final health study late December, I believe, and I think it surprised some people and served as a basis for banning it outright in the state. There have been some questions, though, about hydrofracking waste. A lot of environmentalists have been looking at that issue. Is that something we're going to ban? Or will people still be allowed to ship it, from, say, Pennsylvania into New York? And I believe one lawmaker even asked you about it during your confirmation hearing. I'm wondering what you see as, what should be done there. Should there be a law that says, look, we're not going to do this? Should the administration say no hydrofracking waste in New York?
So it's funny because when I walked in here, I said to myself, I wonder if they'll ask me about fracking. I said, that's old news. It's past, so I guess not. The whole focus here is obviously for the safety of those who are in New York, and we will continue to look at whatever means need to be done to assure that anyone in any community where there's any risk would be taken care of. When the governor charged the department to come up with what we felt was the right recommendation, that was the center point, and it will always be the center point on this.
And also, there's just a few weeks left in session. I touched on a few legislative issues. Is there anything you're monitoring, any bills that you would like to see passed kind of within your purview, or by contrast, any bills that you're concerned about that you would not like to see passed?
We're just looking at all of them right now. There's nothing specific that...
Nothing stands out?
Not yet. No.
Let's see then. Also, on your watch and as acting commissioner over the past year, there was the Ebola crisis, and I think New York City and New York State as a whole was applauded for its response. And I was looking back at your resume that you worked on issues like anthrax, SARS, bird flu while you were in the White House. You also worked with the World Health Organization. I wonder if you could kind of recap, first of all, how prepared were we? And are we more prepared now if a similar kind of crisis were to come up?
So I think this is a great question. The issue here is a lot about preparedness, and there will always be something else that will surface that we will need to be ready for. I think whether it's anthrax, bird flu, another bad flu season in general, which can occur, we all keep wondering when a severe pandemic could occur, which we always feel we are due for at some point or someday. But with regards to Ebola, one did not expect Ebola to end up on the shores of New York, or the United States, I should say. But we were quick to proceed with the preparations that needed to be made ahead of time. In fact, prior to the patient here in New York, we had already had meetings to address this of how to work with those in the hospitals, particularly all healthcare workers, not just the doctors and nurses, but all the healthcare workers that are there, and to get them prepared. I had also asked that all the hospitals test their system, test their emergency room, to see if somebody showed up where the gaps were, and the hospital associations did that, which I thank them for. In addition to that, we also issued the commissioner's orders. So we moved forward as fast as we can, and we feel that we did a phenomenal job of getting that done. Now, what I want to be sure as we move forward is that we don't lose any of that momentum And some of that requires support, and we've turned to the federal government about that as well to get, obviously, financial support for that as well.
Sure, certainly. Also, during your confirmation hearing, one thing you said was your goal is to have the best healthcare system in the country here in New York, if not in the world. But I was looking at some of the healthcare statistics. It doesn't look like New York is really number one on at least a number of major things. I think we're number 5 for life expectancy, which is fairly good. Number 11 in infant mortality. Number 12 for the rate of residents who are uninsured. Number 7 for healthcare expenditures per capita, which is not so good. Number 9 for rate of AIDS diagnoses. And I think number 20 for hospital beds per capita. So given all that, is it realistic to think that we can get to be the number 1 state in terms of health?
So we have to tackle this from from multiple different avenues, I should say. So let's just talk about the AIDS issue. So the governor announced the End of AIDS initiative last year, and we're moving forward on that. And I am confident that that will happen, and New York will be number 1 in ending up eliminating AIDS in the state. So that's one area. There are many other areas to tackle, and you heard this morning from Jason a little bit about Dept. A lot of this comes back to healthcare delivery systems. We need to improve the systems. We need to improve how patients get diagnosed for any disease, managed primary care, as well as the high-end tertiary care that New York is known for as well. So we have to move forward on all of those fronts, and we have to use technology to approach that. I will mention, I think, that we need to look at how technology is used both to communicate, to detect, and to monitor. So one on the communication front is how do we communicate with each other and with patients, and that's where our SHINY, our State Health Information Network of New York, is moving forward. How do we detect things? We need to detect diseases early so that we can get patients treated quicker and also obviously decrease the risk of complications. And we need to monitor people, and that comes back to some of the issues I mentioned before about aging, is that we need to use some of these technologies which are no longer as expensive as they were, and then some of them you could buy right down a nearby store, and to use those as well as to help monitor people. And when we do that, in addition to the other things that you've heard about this morning and elsewhere, I think we'll be right at the front.
Sure, and then you've also, I think, talked in the past about the important role of technology in healthcare. Obviously, it's an important part of the solution, but it can't be the only one. What else do we need to do to improve healthcare in the future? And I guess what is specifically the role of technology?
So I'll get back to the second part. The first part, one of the other things we could do is we need to communicate better. I find it amazing that sometimes one health professional, a doctor, and I'll just speak as a doctor myself, is unaware of what another doctor has done. I personally have been out there. I've walked around like all of us here in the audience with my MRI scan, and then I filled out the extra paperwork, and I filled it out, and I've sat there in the offices, even in the role I have now, filling it out, saying, I just filled this paperwork out 2 hours ago in a different office. So we need to have this much better, and that's part of the benefit of technology. And we need to communicate better with each other, both with doctors. And as I mentioned before regarding technology, we need to pick things up earlier, and we need to use the technologies that are out there to improve people's lives. And I think in some areas, one is obviously the aging population, but in general, we need to do that. And we need to make sure that we continue to train the best doctors that the nation will have.
And the country as a whole is in a transition into digital health records. Part of the question there is, though, the security of them. You've had any number of breaches with major stores like Target, on occasion with banks even. How can we ensure that as we move towards that in New York, that those digital records that are very personal are secure? What is the state doing?
Right. So we're looking at this when we move forward with our electronic health records. We need to have as many fail-safes built in. The fact is that there are, I used to say that we'll have it as secure as any major defense systems, but as you've seen, that there are those who can hack into different systems. But we need to make it as secure as possible. I think that you bring up the banking issue as an example. It is very interesting that most people feel more comfortable or feel, I should say, comfortable today going in, using bank cards, getting financial transactions, and we have to make the healthcare system people feel as comfortable that when it comes to electronic technology.
And then just kind of Bit off topic. One thing I've always been curious about is the infant mortality rate, and it's often mentioned in the media as how the U.S. is really very poor compared to other countries, other wealthy, developed countries. New York's doing, somewhat better than the U.S. as a whole, but I also noticed in your background, you got a start in pediatric care, and you ran a pediatric ICU unit. I'm just wondering what your take is on why the U.S. and New York in specific are behind these other countries in terms of infant mortality rate.
I think that's a tough question a little bit. Part of it is that I'm not going to speak specifically about New York, but in general, in the country, having traveled to many countries in the world and seen what has been done, we push the envelope on a lot of about technologies with kids versus some other parts of the world. I will say that, even in developing nations, of how far we'll push on newborns. I think you sort of have to look at those numbers a little closer when it comes on the international level. As for New York now, we have a lot of challenges. You've heard a little bit about some of the health disparities, so some of the social implications of social determinants of health as well, and I think that we need to tackle that in order to improve the decrease infant mortality rate.
All right, I think that's all we have time for.